dissatisfaction with the fact that we all get old and we all break down, and our job should really be to not guarantee people are going to feel 100% until they just drop dead, but give people as much quality and of life as they can, but realize that not every pregnancy is going to end in a perfect baby, and not every hospitalization are you going to come out doing okay. And I think the lawsuit sort of mentality sort of fosters that idea for good reason, because you're harmed if those things don't occur. So even though it may not be a huge piece of the healthcare budget, and I think most doctors would agree, really think that we need some sort of tort reform, if nothing less than the cap on pain and suffering, which I think is so unfair. If the pallet falls on you at Lowe's and you get $2 million for the pain and suffering, but the person that contracts leukemia on their own, who goes through pain and suffering too, somehow there isn't worth something because they can't blame it on. I think it's a really dangerous idea to try to put a price tag on pain and suffering. And I don't think you'll find any doctors that will say, pay for whatever medical care this person needs for the rest of their life for any negligence. But it's that other issue that's, I think, needs reforming. And then a couple questions on alternative care, chiropractic, naturopathic, massage therapy. These are all helpful things, and I think of various things, especially more on the preventative side, so the naturopathic physicians that practice preventative care and that type of thing probably do have health care cost savings associated with them, and the sort of issue as to who do we cover, who don't we cover. I don't have the answers on that. That's people say we shouldn't have rationing in our health care, but in reality, there's no way to not have rationing. At some point, the cost exceed. Is it? Do we cover toilet seat risers? For people with mobility problems.